Hi, good day, everyone, and welcome to another episode of Let's Talk Psychiatry. I'm your host, Achima, and today, let's talk autism spectrum disorder. You may begin to wonder, what is autism spectrum disorder? Well, I'm going to let you know right now. Autism spectrum disorder is a mental health disorder and a neurodevelopmental disability that affects the development of the brain, which in turn impacts how a person behaves, how the person communicates, and how the person socializes with others. Okay? Now, autism is part of a spectrum, so we call it a spectrum disorder. Other things that is included in the spectrum includes pervasive developmental disorder, not otherwise specified, and Asperger's syndrome. So that are all in the spectrum. People with autism spectrum disorder usually have problems with social, emotional, communication, interaction, and non-verbal communication skills. They also have restricted repetitive behavior, interests, or activities. Now, these repetitive movements and stereotypies include like lining up toys, flipping objects, saying out specific phrases. They usually have preoccupation with unusual objects. Sometimes, most of these people could have excessive smelling or touching of objects. They can also be fascinated by some lights, and sometimes they cannot tolerate specific sounds, noise, or textures. Okay, so how do we diagnose autism spectrum disorder? There is no blood test to diagnose it. All right, the doctor has to observe and monitor the child's behavior and development for there to be a correct diagnosis. Now, symptoms must be present at, by early developmental age and childhood. So that was where the symptoms start. Males are more affected than females in a ratio of 4-1. People with autism spectrum disorder, they don't necessarily need to have intellectual disability co-diagnosed with it. In fact, some may even have some seventh abilities like being a math genius or being a music genius, or they can draw very well. Now, areas of impairment is usually seen as early as 12 months of age. And these symptoms include like lack of attention, decreased eye contact, they're not responding to your name when you call them. So a hearing test should have been done to rule out deafness. Also, there's decrease in joyful affect. There's presence of the stereotypies I mentioned earlier. There's a delayed speech. Now, language signs of concern that we need to be concerned about is when there's no babbling at 12 months of age, no first word by 16 months of age, and no two-word phrase by 24 months of age. Now, what are the causes? There is a primary autism, which makes about 95% of cases. It's usually thought to be caused by a combined effect of multiple genes. Now, I recently read a study that showed that children with parents who have a sibling with autism spectrum disorder, right, they are at a higher risk for getting the autism compared to the general population. So let's keep that in mind, okay? And now there's also a secondary autism, which makes roughly about 5 to 10% of cases, right? This is due to another cause, something like genetic mutations. Teratogens, these are the things that the mother is exposed to while she's pregnant that will eventually affect the baby in the future. Something like lead poisoning, a medication that we can use like Depakote, and infections like rubella. So there are some factors that increase the risk of having autisms, and this include advanced maternal age when a woman is more than 40 years old when she's pregnant, advanced paternal age when the father is more than 50 years old. There's a short interval between pregnancies, pregnancy-related factors like maternal hypertension, maternal bacterial and viral infection, when the mother is hospitalized during pregnancy. Other things include like preterm birth, less than 32 weeks when the baby is born, low birth weight baby, and small or large for gestational age babies. So how do we assess autism spectrum disorder? Parent reports, teacher reports, child observation, use of rating scales, medical assessment like hearing and vision tests, lead levels, EEG, because some of these people have seizures, and finally, genetic testing. Now, treatment, we have type 1 treatment, which is a treatment of the core symptoms. Here, treatment is aimed at social and language problems, so we call it psychosocial treatment. Now, this psychosocial treatment include things like behavior modification, communication tools, cognitive behavioral therapy, CBT, speech therapy, special education, and parental management training. Here, no medication is used. Now, type 2 treatment, this kind of treatment is used for problem symptoms like self-injurious behavior, like when the person is aggressive, irritable, they have anxiety, hyperactivity, distractibility, obsession compulsions, and also sleep disturbances. Now, antipsychotics like Risperdal, Abilify, they're FDA approved for irritability associated with autism disorder. So, there you have it. This is just like a small summary of what autism spectrum disorder is. And please do not use any information I say here to diagnose anybody. Instead, this should serve like an awareness to what autism spectrum disorder is. If you know anyone with symptoms that I have mentioned, please advise them to see a psychiatrist or a pediatrician who will make the proper diagnosis and start the adequate treatment. There you have it. If you have any questions, please send an email to letstalkpsychiatry@gmail.com. Let's be aware of our mental health and end the stigma that kills us all. Until next time, stay safe. I'm Sachima. Stay healthy. See ya.